I think a lot of the answer to that one has to do with the care model that you're building around that dispense, and that's something that we've worked very closely with health partners, our health partners on, in terms of whether it's deploying like a pharmacy liaison in the clinics that you're supporting to address all the pharmacy or the administrative related burden associated with specialty pharmacy scripts. We then, are layering, folks like, Hinal onto that as well to make sure that patient's staying adherent, address side effects, making sure the patient's like fully educated, on their meds. And then I think we spent as a company probably the first like 6 or 7 years just focusing on that core model, and then realized that there was more that we could do. There was other disease states we could tackle. There was more that we could tailor, to it.
You hit a lot of it. I would say the biggest thing is it's not like a one size fits all option. We have the opportunity to really tailor our care to what each specific patient needs using a library of resources. So we've got, of course, the clinical knowledge, the medications, nutrition, lifestyle modifications, bring it all together, and you can collaborate right there with the clinic. So it's been a huge improvement for sure. I would say the best way to compare it, in a traditional model, you're getting a lot of counseling around medications, and of course we're all well equipped to counsel on lifestyle modifications, but you just don't have the time that you need to really give the patient what they need. In a program like this, you can meet with them weekly, set small incremental goals, and really help them. I guess a good way to explain it is you go to an appointment with your doctor, you see them every 3 to 6 months. You leave that appointment with a library of things that you need to be working on. And it's a long list that can sometimes just feel almost a little bit, you lose that motivation. There's a lot to do. So we can break it down step by step, week to week. And you don't always have the opportunity to be able to do that when you're in a traditional specialty pharmacy model.
I think another thing we've observed through the Care Coach program is that there's a certain cohort of patients that are dealing with so much, and that it's the social determinants of health that are the primary barrier. That if you don't get over that, the normal like AmCare pharmacist services just aren't going to have that impact. And that's one thing that Hinal and team have done a great job of, is screening for that. And because obviously if someone is on the precipice of getting evicted from their house, they're going to be a lot less likely to remain adherent to the medication. So knowing when those things are coming up and having the tools to refer to the right types of resources is really critical. So the short answer to that, I think, is gradually. It's definitely something that doesn't happen overnight. I think one thing that's really important for health system specialty pharmacies, and that's kind of like our area of specialization, is to make sure that you're really getting those core competencies in core pharmacy set, because will inevitably see comorbidities come in that are outside the traditional specialty scope, like diabetes, like COPD. So you'll develop your skill sets servicing those as a comorbidity, and as time goes on, you'll be prepared to address those patients that have that as a leading disease state. And then as you dive deeper with clinics, you realize that there's always going to be those cohort of patients that, to Hinal's point, need a lot more of that in between appointment support. And that's where we have found the bridge from traditional specialty pharmacy to chronic disease management. And that specialty pharmacist skill sets, turns out, are really, really well positioned to provide effective chronic disease management.
I'm leaning towards primary hub. The reason I say that is you can bring things together from all aspects of the patient's medical care, almost acting as that one patient advocate within an entire clinic. So when you have the pharmacy and the clinic, and then you have your one person that you can go to for all of your answers that's easily accessible, you end up becoming that hub, and you're passing on the advice and re-encouraging them to follow recommendations provided by their entire clinical care team.
And we're already seeing that expansion, especially pharmacies that are moving more into retail because they want to be that one-stop pharmacy resource for patients. So to do that, they are having to fill not just specialty medications, but also maintenance medications, durable medical equipment. And that is increasingly making them that central hub. And one thing that we'll be talking about a bit in our presentation today is that it also makes them, at a minimum, a really valuable population health tool for the population health teams and managed care teams to leverage more and more to drive savings, drive incremental, pharmacy revenue. There's a lot of, wins that come out of, sort of merging those two worlds.